All right, here we are. Nobody's within 10 feet. That's my social distancing rule. 10 feet, but yours, anybody else, you make your own up, but 6 feet is fine. And good afternoon. And my name is Dean Mazzarola, Mayor of the City of Leominster. Happy to be with you. Thank you for joining us. Lots going on today. It's been a busy day, as it has been every day, and lots of questions. And we try to get the most amount of information out to you as fast as we can. Obviously, the 11 o'clock press conference today pretty much had the most amount of people that I've seen watching on Facebook, like 6,000 on Channel 5, I think. WCVB was Channel 5. And then we shared it. And then our community development page shared it. And I can see all the Leominster residents commenting on there, or at least liking it or whatever. So we do add to the spirited conversation here. So just got the latest numbers. Let's see how they stack up. Bear with me. Oh, that's weird. Okay. Are we streaming out over Facebook? Yes? Is anybody watching us out there from Facebook? I assume they are. Mine doesn't show it. It says, please stand by on my phone. Let's get to numbers here. We'll do that right away. Okay, let's get to the numbers. Okay. So Leominster numbers are, what happened there? Okay, so we are at 238 for positive, and that is down 9 from yesterday. And we are 231 completed. That's the biggest jump yet, at up 19. So 238 testing positive still, and that's up 9. And 231 completed, which means they've off of sort of quarantine in 7 days without a symptom. So those numbers are moving in the right direction. We'll wait to get the state numbers. I don't think the state numbers are in yet, and we'll wait a little while to get them. But we have a lot to talk about today in terms of what the governor announced today. I'm not sure. Okay. Lots of people want to share information. Let's go right to the slides, guys, because you know what happens. I get caught up and derailed. There's our phone numbers, important phone numbers for the week. As we always say, we're not doing this just to divert your attention, but sometimes there are forms that you can go over, download, and then go over at your convenience, so you're more familiarized with them. So we're not just sending you there to kind of push you in another direction. It's not at all what we're trying to do. But if you can get what you need off of our website, leominster-ma.gov, that's fine. If not, you could call our office, 978-534-7500, extension 0. And we have everybody's extension number. Everyone in the city, everyone has a phone. Many have cell phones. We can track anybody down and get you your answer. So 978-534-7500, extension 5055, and over at Emergency Management, 978-534-7500, extension 5055. So we're extension 0. Emergency Management is 5055. That's a special number set up for COVID-19 to answer any questions you might have if you need something, right? Just say hello to somebody, just so you have an outside contact to the world. So there are important phone numbers right there. And everything you see here, you can find on our website, again, at leominster-ma.gov. For state assistance, right there's the top one, mass.gov/DUA for unemployment benefits to apply for self-employed contractor unemployment benefits. So you're self-employed, mass.gov/PUA. And then for all the other things like SBA and sexual assault, domestic violence, special line hooked up for 785-2020. Family Health Line for nursing home patients, 617-660-5399. And some more pertinent questions over there. Chamber of Commerce, Mass Tech, again, SBA, and you can find all of these connections, all of these links for employee business assistance, Leominster-ma.gov. Resources. So tomorrow through Saturday, Ginny's is open, and I want to remind you of that. But before we do, remember the Red Cross is still looking for donors. 1-800-RED CROSS or redcross.org/Massachusetts. Resource for kids and the rest of the family, leominsterlibrary.org. Free Wi-Fi at the back of the public library. Conservation information, fun stuff for the kids. Find it on the conservation site. But first go to leominster-ma.gov. Updated every Wednesday, Senior Center parking lot 11 to 12. Growing Places has fresh vegetables and fruits. And Catholic Charities starting out tomorrow, 8:30 to 4:30. You can find them at 978-840-0696. Ginny's is also open tomorrow till Saturday. And they're doing some construction work there, so you may need to sort of shuffle your way around a little bit. But they are open 10 to 1. And remember, we have a partnership with them. The city does. And we've been doing deliveries each day to those that just can't get out of their homes. 978-537-1387. There's our cases since Monday. Since Sunday. Death rate has dropped. I hope that continues to drop every day. I'm keeping my fingers crossed in terms of what might happen today. And let's hope those numbers go down. We really, after 10 weeks, been tough. I told you last week I saw 4 funerals going on, I think, all at once, or within a relatively short amount of time, and they were all COVID patients. People had succumbed from the virus, and just a surreal thing. And so, the balance today, certainly for the governor and other elected officials, is, we've got hovering on 90,000 people across the country who've passed away from this virus, not to be taken lightly at all. And at the same time, at what point do the numbers and the data tell us it's okay to begin to return? Remember, normal isn't normal. Normal is just getting, the first steps of normal are getting back to normal. If you own a restaurant and you've been closed, some of those restaurants around town have been closed. They are, it's a significant investment in getting started up again. I know Columbia Tavern is open, either open or opening, and a substantial investment will be needed to bring in all of the food supply that they need, getting the staff back in there. Maybe not all the staff are coming back, so you have training. Then you open the doors, and you've got to be ready for, we don't know how many customers, and everyone is sort of, complying with the new CDC guidelines, so you have that to do. And so it's a lot. There are a lot of restaurants around the country that just said, we just can't do it. The risk associated with getting started and the cost just sometimes don't make it worth it. So the reopening plan, let's get to the first part of it. People over 65 who have underlying health conditions should continue to stay home, except for essential grocery stores or healthcare needs. And if at all possible, make use of those delivery companies and those like Hannaford to go. All residents are advised to leave home only for healthcare, worship, and permitted work, shopping, and outdoor activities. Well, why else would you go out? All residents are required to cover their face when they cannot social distance. So when you're driving your bicycle, riding your bicycle, driving down the street, and there's nobody else near you, running, walking, hiking, and there's nobody around you, and you've got that social distance, you can leave it on. Hey, if you like it and you leave it on, you feel better, you leave it on if you want to sleep with it. But it's not necessary, but when you do sort of get into that little alarm that says, cootie patrol, cootie protection, then you pull up your mask. Okay, all residents advised to wash their hands frequently, at least 20 seconds. All residents are advised to be vigilant, monitor for symptoms, stay at home if you feel sick. Use the phone or computer instead of visiting people in person. Refrain from visiting nursing homes, assisted living facilities, and parents should limit play dates for children. So don't you be bringing your cooties over to somewhere else, okay? Keep your cooties at home. I don't know. It just sounded authoritative, like I knew what I was talking about. So don't share cooties. Only leave home for permitted activities or health care. Okay, so here we go. This gets a little bit convoluted. There was a lot of information that the governor had shared today. And there was some confusion. All you have to do is, what did I say would happen, right? Week 6, people begin to get a little itchy. Week 7 and 10, right? You guys heard me out there, right? Week 7, it gets a little more edgy. But by week 8 and 9, people have had it. We're into week 10. The threads are going to be, hey, Governor, nice job. It's going to go over to, okay, we've had enough. Let's open up. Let's open the beach, whatever. We've had enough. We're willing to take the necessary precautions. And the governor's saying, yeah, I know you say that, but, you know, I have to absolutely make sure that we're minimizing our risks. Did I sound like Como there? Minimizing our risks at the same time of opening things back up again. So here we go. The current state, stay at home, essential businesses and services only. I'm not quite sure who's not essential anymore. The whole world is pretty much essential, right? Aren't they? Is that what we're beginning to find out? And government, if you can say people aren't essential, yeeks. I don't know how you say government workers, federal, state, or whatever. I know during a snowstorm they say, hey, stay off the road. And government employees, you know, only if you're essential come in. But how do you say you're government operating in a pandemic and not suggest that everybody is somehow or another essential? So, phase 1, bang, out of the gate, starting today, limited industries resume operations with restrictions and capacity limits. Phase 2 is cautious. Additional industries resume operations, again, with restrictions. Phase 3 and then phase 4. Let's get to each one of these things. They last a minimum of 3 weeks, and depending on the data, the governor's saying, I don't want to close things and then open them again. So he's going to rely on data. Now, here you go. No matter what phase, a business will be asked to comply with the following. Again, nothing's changed. Not yesterday, not 6 weeks ago, not 10 weeks ago. 6 feet apart. That did change, right? Used to be 3. 6 feet apart, inside and outside. All people. So if you're in a work environment, wear your mask. Go into a hallway, a common area of an office building or whatever, wear your mask. If you're sitting alone and you're in your office and there's nobody around you, you can take it off. All people will be asked to wear face coverings, provide hand washing capabilities, sanitize regularly, training for employees on all of the above. What's to train? This is what we've been sharing for the last 10 weeks. Anybody within 6 feet, all people need to wear their masks. Stops those cooties from getting dispersed into your cootie protection area. Sanitize regularly, training, plan for employees who become ill and for their return. Establish cleaning protocols. The dashboard for public health indicators will be updated to show you how your state is doing unless you're colorblind. Anyway, there'll be basically a stop and go, a red and green. It'll tell you how you're doing there, right? Number of individuals who died from COVID, number of patients in the hospital, healthcare systems, readiness, right? This is how things will be done based on this, but you can also follow along if you go to mass.gov and look for their website, and they will explain everything to you. So that's how it's going to be done with a dashboard. Reopening will be driven by the following factors: 7-day average of positive test results, 3-day average of hospitalization, which, by the way, is down to 3%, hospitals' usage of ICU surge capacity, 3-day average of deaths by date of death. So it's up to us. The more we practice social distancing and all of that, and so you can go to work and your employer can do everything they can to give you all the things you need and give you hot water and soap and sanitizer and mask and tell you what you do. But if you go home over the weekend and you all of a sudden you hang up your social distancing and you hang up all those sort of preventive measures, then you get it and then you share it, or you share it, give it to somebody else who then shares it again. Okay, what can open? Well, the day after Sunday, church can open, and they have guidelines. Outdoor services are encouraged. Now, we started talking to various churches and places of worship a while ago. And what we said to them is prepare for 2 or 3 different options. And one is, if the weather's nice enough, do it outdoors. It's just the best way that you can do it. What if you have 50 people show up? Maybe break up into groups of 10. Maybe you have other ministers or deacons or associate pastors, pastors in training, whatever, I don't know, whatever it might be in whatever place it is that you worship. Rabbi, whoever it might be. Break up into smaller groups, right? There are a lot of things that you could do. You can do it in your car. Everybody get an FM transmitter. They're pretty cheap, and transmit the message of the day and the sermon and all that. So yeah, I think most are ready. Did get a few calls today from some churches interested in whether or not they could use city property. So we'll get back to them on that. We haven't thought that far out yet. I don't see why not, but we don't always have restroom capabilities right now. So that might be the only drawback. But businesses that can open today, restrictions, essential businesses that are already open, manufacturing, construction, and then again, churches. Healthcare, hospitals, and community healthcare centers can provide high priority preventative care and pediatric care. All right? So any of this is available on the state's website. If you need to go there, it's pretty easy. You just go in and plug everything in, ask it what you want to ask. It'll tell you that certain industry and whether or not it's permitted, and if it's not, when. What can open May 25th? Well, laboratory and life science facilities, which I bet you have been all opened anyway. Offices excluding Boston. Work from home is strongly encouraged. Businesses should restrict workforce to the presence of 25% or less maximum occupancy. Hair salons and barbershops by appointment only. Already made mine 12 weeks ago. Pet grooming by appointment only. Car washes, exterior wash only. I saw car washes open. Recreation and outdoor with guidelines. Other healthcare providers who attest to specific health safety standards can provide high priority preventative care. Remote fulfillment and curbside pickup. This is all starting the day after Memorial Day. Yep. And then recreation, including beaches, parks, drive-ins, some athletic fields and courts, many indoor adventure activities, most fishing, hunting and boating, outdoor gardens, zoos, reserves, and public installations. That's all on the 25th. So I guess you can't go to the beach during Memorial Day. Is that right? Memorial Day is, I think. Let's check. Let me look. Memorial Day is next week. And so that would mean, you wouldn't be able to go to the beach if they're closed. Okay, so if this doesn't make any sense, we have 2 stellar employees on our team who are knee-deep in this. And if you'd like to ask them questions, you call our office at 978-534-7500, extension 0, and we'll put you in touch with them. And somebody asked me about tanning salons. Tanning salons. Did anybody? I couldn't find it in there, but it doesn't mean it's in there. There's a lot in there. And so when you have a little time, sit down and go through some of those things. I'd suggest you get on the phone and maybe make your pet grooming appointment, maybe make your hair salon or a barbershop appointment. What can open in phase 2? Well, worship only with updated guidelines. Outdoor services encouraged. Potentially updated guidance for phase 1. Businesses with some restriction capacity. Retail, restaurants, lodging. So phase 2 is when? What's the date on the phase 2? Let me see if I can find it. Anyway, I'll find it. Additional personal services include nail salons and day spas, healthcare, expanded ambulatory in-person routine care, less urgent preventative services, procedures including routine dental and elective procedures, day programs, adult health, recreation, campgrounds, playgrounds, public and community pools, all athletic fields and courts with guidance, youth sports in limited fashion. So you see, we've been planning everything the right way, right? We had option A, B, and C. Good stuff. What can open in phase 3? So we don't have the dates on it. Are they going to determine it? Are they going to determine what opens by the data? Is that how they've said that? Because they know
said
that.
a minimum of 3 weeks unless they have to push
All
it
right,
back.
all right. So
June 8th would be phase 2.
So phase 2 would be June 8th, you said? And then it would be 3 weeks from there to phase 3. So you're looking at phase 3 right now. These are the things that you'd be able to do in phase 3. So 3 weeks makes it June 8th, and then after June 8th is 3 weeks. I guess that's how it goes. A lot to say, huh? A lot going on. What does phase 4 look like? Full resumption of activities with continued social distancing. Crowd size will be continued to be determined. Again, what have we said from the very beginning, right? Until there's a cure, and even then, who's to say everyone's going to get the virus cure, right? So even during flu season, there's a, well, so-called, right? We're going to get to that point where people are going to say, I'm not getting the virus. I'm going to just go without it because I don't want that in my body. So the vaccine is something I have questions. And believe me, there'll be at least 100 articles before they actually come out with the cure. There'll be articles about side effects and testing, just like everything else. And then some people won't get the vaccine. And then other people will be nervous about the fact that some other people didn't get the vaccine. So to some extent, this is, I think, the mask will become just part of our attire. We'll get fancy masks to match whatever we're wearing, logos. It's going to become part of the decor. Okay, let's go to the next sample of construction protocol to reopen. There you go. I'm not going to read every single one of these, but if you're sick, don't come to work. Temperatures taken at beginning and ending of each shift. Wash stations must be installed. All workers to wear cut-resistant gloves. Must have COVID-19 compliance officer on site. This is all to get a construction site open back up. That's assuming. Now watch. We're going to go into the point where we're not going to be able to find gloves, those wear-cut gloves, resistant gloves. I guarantee you, they'll be in shortage. In fact, probably by now. No activities with larger groups, tailgating, several people work in the same areas. It's all common sense. So what you have to have a compliance officer now, and they'd be the ones that tell you you're too close, whatever. Sample of places of worship protocol to open. There you go. If you're interested, go to our website, leominster-ma.gov. Got to wear a mask. Urge to have a system where you sign up ahead of time to services with self-monitoring of attendance, signage of, go into Census Hill, you fit 200 people and everybody's 30 feet away from each other. But then there are other temples and other places of worship that people are much closer. So it's all common sense, right? So we will be glad to help you if you have questions about this. Hair salons protocols, they can arrange the chairs so the work areas are spaced out, install visual markers to encourage customers to remain 6 feet, stagger lunch breaks to regulate maximum number of people in one place, close and configure the break rooms to allow for social distancing, require face coverings for all customers and workers, require workers to wear gloves, gowns or smocks, glasses and goggles, install physical partitions between workstations where possible, glove changes between each customer, limit service to hair customers only, no eyebrows, beard trimming, lip waxing, manicures, close waiting areas and ask customers. This is stuff we've already said, right? Remember we're at the claw shop? This is exactly what we said. And you know why? Because it's all common sense. It's all common sense. Speaking of common sense, I keep losing all my messages. Okay. Assessing every penny from the CARES Act. Cities put in we're eligible for 3.6 million, almost 3.7. We need to orchestrate this between the school department and the rest of the departments in the city. So that's well orchestrated. We've been asking everyone to keep track of all the money they've spent over this time since this all started, because getting reimbursement isn't really about, yeah, here's what we need, send us a bunch of money. It's documenting and being accountable. So those are two extremely important words when we apply for this funding. Guidelines. So there's guidelines on everything. They're pretty much the same for everything, but there's the new CDC guidelines for schools. And again, the state will be putting out some, I'm sure the state and DESE will be putting out some guidelines for the opening of school. I would like to see, and I'll ask the school committee and the superintendent to put together a number of different scenarios that fit Leominster specific. And that might be a couple of different things. And I threw a couple of them out there this morning, and I'm just throwing things out there just to get us all thinking. But remember, we did a whole lot of these what ifs from the very beginning, and we were right on. In most situations, we were right on. So we are prepared for business openings because we've been working with business, and business has been working with us to get creative and to get ready for these dates when businesses are allowed to open. Same thing at workplaces, not much different. But you can get this all on our website at leominster-ma.gov, and I'm not going to go through them all, but they do exist. You can also go to the CDC website because they have one for restaurants and bars, youth programs and camps, child care programs, mass transit. You heard in China, they are back using the same amount of fuel that they were using pre-COVID-19. Why? Well, people aren't using public transportation, they're using their vehicles. People are using vehicles more often. So what does that mean? It means they're back to using the same amount of fuel they were consuming before. What about rec camp, summer camp this year? We'll do that, but it may look a little different. It may be more smaller group functions. So we may start off with art in the morning, and it might be a 2-hour program. Could be longer. Could be art for 2 hours, introduction to art for an hour or two. Could be more, serious art at, for 2 or 3 hours. Could be golfing. Could be whatever, cribbage. I don't know. Whatever you want to do outside. Whatever it is. Could be instruction to tennis or golf. It could be hiking. All those things, but there'll be smaller groups. Okay, for those looking for funding, do we have a read on how many people have already put in? Because we have $272,000 that we've gotten from the federal government to share with local businesses. Now, there are some conditions. I'm not going to tell you there aren't. There are. But the best thing to do is to go to our website at leominster-ma.gov, see where the arrow is. The first thing that's going to come up right below City Hall, it says City Events. You click right there. It's going to take you to the application. It's going to take you right to the application. You fill that out as best you can. If you have any questions, you call us. We're here. We would really like to make sure that you have a good application in. So if you have any questions, give us a call, 978-534-7500, and we will help you in every way possible. More information, $272,000. Here's who's eligible. There are 2 components. Micro enterprise for businesses with 5 employees or less, including the owner. The owner must earn an annual household income or equal of less than 80% of the area median income. Or the other part of the program is the small business having any number of employees where at least one job is either retained or created or recreated in this case by a low to moderate income employee. You'd be surprised how many of your employees are low, moderate income eligible. Leominster, you have to be a business for at least a year. You have to be a Leominster business. You can't be it must be a for-profit business. Total amounts, $2,500 for each qualifying business. Funds will pay for rent, mortgage, and or utility payments. Anybody's got one of those due pretty soon, right? So submit your application and most recent tax return to grants at leominster-ma.gov. State also has an opportunity, catch that on our website. Leominster-ma.gov. That's through the State Treasurer's Office. Okay, somebody asked us yesterday to go through these numbers, and I will. And I guess they found them relevant. So here's the Worcester County cases, and you can see that around May 13th, we had spiked up after having a good week the first part of the month, and then it spiked back up. And then it dropped down a little and went back up, and now it's gone down for the last, say, 3 or 4 days, so that's good news. So this is as of yesterday, total and daily and cumulative confirmed cases. More testing that goes up. See how much more testing? That's that line. That's that blue line that's going up. That is the testing part of it all, and then at the bottom is confirmed cases. So the more testing we do, the more cases. Testing by date, number of tests performed by date. Again, more testing positive. Cases in growth by county, again, on our website, leominster-ma.gov. The prevalence by county is getting better. There's actually some communities that were far worse. They were in the dark color. They are getting better. And so you see that map is changing. More light blue and Leominster blue, as I call it, a little Leominster blue. Yeah, so Barnstable now in that powder blue. They were once in our blue, so things are getting better. Daily and cumulative COVID-19 hospitalizations, that number has dropped down to 2597. Daily and cumulative deaths, 5797. And you can see the testing there as it relates, so still. Cases by age, average age is 53. Hospitalization is 68, so that's gone up, actually. The average age of hospitalization has actually gone up, and the average age of deaths in confirmed COVID-19 cases has actually remained the same at 82. You can see to the far left and to the right, numbers for deaths really small. One is too many, but very small. Then it kicks in at the 70s, and then it really kicks in at the 80s. Male and female, deaths by sex is male-female, pretty comparable. Let's see, deaths with previous hospitalization, still about the same at 56%. I think it was at 58 at one time. And then those with pre-existing conditions, or as they call them, underlying conditions at 98%. Ethnicity, again, I've heard a lot about this over the weekend and how a real good look is going to be needed on this and why, the question why. And we'll have to dig a little deeper. Have we not reached the ethnic communities, those ethnic communities where maybe there might be a language barrier? COVID cases in long-term facilities. Total hospitalizations. Capacity by region. Looks like everybody's in decent shape. They could handle more if necessary, but let's hope that's not the case. And then if you want to be tested, so there are a couple of restrictions to be tested, and that is you can go to Health Alliance between 8 and 4, but you do need to have some symptoms, or you have to have been exposed to somebody that tested positive with symptoms for COVID-19. It's same at Reliant, but you call them. They're going to turn you over to somebody else that's going to ask you some questions, and they're going to ask you questions, and then based on your response, and even if you heard today in the governor's update, more and more tests will be done, almost 500,000 so far. As those tests go up and they find more and more people and they do tracing and find more and more people, they will get to others who haven't been tested and high risk and maybe government people or police and fire. And so they will just weigh the risk, and that's how you'll be tested. So more and more people tested every day. Don't forget, Starburst has moved up. Sonny has had to cancel the summer concert series in the Carter Park bandstand. Taxes are due June 1st, and there will be any extra fees, and as well as if anybody tried to pay online, from what I'm told, is it tried to tack on your fees. And we'll try to straighten that out. So if there's anybody in my office that's watching, remind me tomorrow. We'll take that up, that somebody had gone into the website, tried to pay online, and we do allow it for people to pay it online and pay it, later than May 1st. However, I guess they ran into an obstacle where they wanted to charge them extra money. So we should straighten that out if that's the case. How do you pay your bills? After March 10, if you got a water bill or an excise tax bill, there's no extra penalty or charges. And again, you can pay online. You can pay at leominster-ma.gov. You can pay by walking up the front stairs at the City Hall. There's a mailbox to the right. Or you can do it the old-fashioned way, put a really cool stamp on your envelope, and off you go. Comcast Essentials, 1-855-846-8376 for those that don't have internet through Comcast. And it's, I don't know, around $10 a month. And then, I'm sorry, it's free for 2 months and then about $10 a month after. Stimulus checks are still coming in. Yes, you can go to the IRS website. If you haven't got it, you want to ask or find out, hey, where's my check? Don't forget, Memorial Day is coming, and the Veterans Project is asking those who go to a cemetery to help spruce up. Sorry, need water here. The lips are sticking. Spruce up. Spruce up the cemetery plots where maybe a veteran's wife can't get there, a spouse. Maybe their family's not living close, so they can't come here because they're restricted from where they are. Well, help up, spruce up those. And you see those markers on the ground, just cut around them. If there's weeds growing around, it'll look beautiful for Memorial Day. And speaking of Memorial Day, yes, we won't have the large crowds that we typically do, but we will have a group of 9, and we'll be visiting every cemetery. Also, every veteran's plot will be flagged. April 6th to the 30th, 2 weeks left to go for yard cleanup, yard waste. Don't forget, we're giving some cool prizes, starting with, if you have the most amount of leaves and you send a picture to myself, dmazzarella at leominster-ma.gov, you could win some big prizes. So get out there and rake 24/7 if necessary, because you need to be the winner. You're going to get a free a gift card from American Harley Davidson, Claw Shop. Let's see. Don't worry. I'm waiting for the last for her because I know she's going to watch and say, what about us at Global Gym? Yes, Global Gym, Central Flag. And let's see who else. Oh, Turf Tender. So get them out, pick them up, send a picture to us. Dog license extended to June 1st. Water Department's working on Sunrise Ave, Farm Hill, Day Street, Main Street. Registry update, if we really have to go, most things have been extended, but if not, go to the website. They tell you everything you need to know, and if they tell you have to go, 857-368-8000. Online shopping, as they begin to loosen up with some of these regulations and allow curbside pickup, I don't understand that part. And maybe it's because I'm a business owner, but where there are maybe 1 or 2 people that go visit in the store, maybe an hour in some stores, why aren't they allowed to open? I don't understand. But anyway, it's another week for curbside. No, it's 2 weeks before they can do, well, next week, I guess. We're on Monday, so yeah, next Monday, Tuesday, you'll be able to do curbside pickup at some businesses. Time for Dr. Mazzarella's boot camp. Don't forget, wash your hands. Avoid touching your eyes, nose, and mouth. Even after I just got through saying that, you're going to want to, but refrain from that. Clean things frequently. Cover your mouth when you cough or sneeze. Stay at home if you're sick, and think ahead and think about other people who you may need to help. Don't forget, the virus is something that we give to everyone else. We give to each other. Assume you have the virus. Assume everyone you come in contact with has the virus, and assume every surface that you touch or come near somehow or another is compromised, and make sure you clean those. Wash your hands when you can't, then sanitizer. Don't forget, we're still giving free mask out at emergency management from 8 to 4, City Hall from 9 to 4. Today we're a little short-staffed, so if anybody came by and couldn't get them, you by all means come back and we will make sure you get them. Thank you to all those. Our list is growing. $58,000 we've raised. $58,000 for the COVID Relief Fund. Isn't that amazing? Thank you. Okay, well, maybe check. I'll have the persons who had trouble getting those extra fees added on, contact the Treasurer's office. Senior shopping, it's best to call first. Plenty of restaurants doing takeout. Friday and Saturday night, some of them were just overwhelmed. I don't even know if they can answer the phone. And off-premises sales, some can sell alcohol. 192 ounces of malt beverages, 1.5 liters of wine, 21 years old to deliver it, 21 years old to receive it. So there are rules in place. We haven't had any complaints. Leominster parks are open. Tomorrow morning, I believe, I'm going to be at Shoalin because I want you to absolutely... Did anybody go to Shoalin today? Did anybody go to Shoalin Farms today? It was so beautiful up there yesterday. I don't want you to miss it because it only happens once a year, and it's only for a few weeks. And we're lucky to make it through that storm the other night with still having buds on the tree. Because that wind, those winds were unbelievable. And up in that south side of Leominster, we had a lot of trees come down. I mean, some big trees that you would never have thought would have come down, and they did. Okay, don't forget to fill out your census, please. Don't forget, we're only 66% of the way there. That's better than most people in the state, but still, you need to fill that census out, get it filled out, send it to them. They'll get off your back. Otherwise, they're going to start mailing things and banging on your door. You don't want that. Fill it out, send it in. If you didn't get it, just go to our website, or you can call the clerk's office, and they will help you to get your census form. That's it. Hey, look at us, Bradley, 45 minutes today. How's everybody feeling? Did you watch the governor's update? I'll ask that question in the last minute. Does it make sense? Were you able to understand it all? It was a lot of information in a short amount of time. You could definitely see people's frustration. If you just read the threads under the Facebook, clearly people are frustrated. And there are those who have said, and rightfully so, just lock everything down, stay home, don't go out. That's the safest thing to do. And you can hear in there the frustration from small business owners who were saying, I'm getting to the end, and I want my business to stay open. I'm trying to survive, but I can no longer do it. And you tell me what the restrictions are, and I'll do it. I'm just not going to be able to get another week or two or another month. So you can see I can understand every single person's read on this and their view on it. I respect it all. And yeah, so it's just the difficult decisions that need to be made. It's week 10. Okay, masks are free tomorrow. Tell your friends. If you need another mask and yours is getting a little worn out, and I don't know, whatever, right? I told you what I do. Just put a little something up here. Mine still smells good. I put my lip gloss on here, Lipex. I put a little bit in there. Maybe you want to stick a little, I don't know, mint or something up here. You try something. Nah, that didn't work. Mint, or somebody said Vicks, a small amount of, just a dab is all you're going to need. And boy, it changes everything, especially as things get warm. So pretty much nothing's changed. The word is out, and social distancing, if at all possible. When you can't, you just bring out this mask, and if you don't have one, come to City Hall. We'll give you one tomorrow, 9 to 4, 8 to 4 at Emergency Management, 37 Carter Street, and we'll be in good shape. Okay, I think I've pretty much covered everything. Gonna take a swig of water. Remember, and a lifesaver. Remember to be kind. Remember to be generous when you can. Be thoughtful. Be well. Be the care. Look out for some other people. There are so many other people that are out there that might not understand this completely. Look out for them as well. Thank you to all those essential workers, all those in the healthcare, public safety world. It's been quite 10 weeks. 10 weeks. Imagine nurses and the staff at the hospital and the doctors wearing these masks. This is like week 10 for them, and some longer. And this isn't even the mask they wear. Okay, signing off now. Thank you, Bradley, Keith. We'll see you tomorrow bright and early at 9 o'clock. Make your toast, get your breakfast ready, and we'll update you from beautiful Shoalin Farms. That's your orchard. You own that. And tonight, still be a beautiful night to go up there. It's not raining. Just go up there. Again, you remember all this. The CDC, keep your distance thing, put the mask on. You got all that. Hey, by the way, we got to meet Johnny Cash yesterday. Johnny Cash was up at Shoalin Farms. I didn't want to brag, but I just thought I'd mention that to you, that we met Johnny Cash. Okay, see you tomorrow morning, 9 o'clock from Shoalin Farms.